When a consumer reaches checkout, they're no longer browsing, they're buying. It's a moment of peak intent, attention, and engagement. That's where Rokt comes in. Rokt helps brands reach customers at the moment that matters most, delivering relevant offers and content that feel like a natural part of the transaction experience, not an interruption. Learn more at rokt.com. Hey gang, it's Monday, June 8th. Rajiv, Beth, and listeners, welcome to Behind the Numbers, an eMarketer podcast made possible by Rokt. I'm Marcus, and joining me for today's conversation, we have two of our healthcare and pharma marketing experts. We're joined by senior analyst Rajiv Leventhal.
Hey Marcus, thanks for having me.
Yes, indeed. And we're also joined by senior analyst Beth Snyder Bulik.
Hey Marcus, thanks for having me.
Why, of course. Today's fact. Okay, this one does not seem real at all. And I know after I say it, you're going to be like, oh, I'm going to Google it myself. Fine. I don't blame you. The word muscle, do you guys know where this word came from? It's like every word, which when I say it, you're like, of course it came from Latin. But it comes from a Latin term meaning little mouse. National Geographic noting that ancient Romans thought that's what a flexed bicep muscle resembled. A little mouse underneath like the skin in your arm. And so that's where it's musculus is the term, Latin word for little mouse. Kind of horrible to think about.
Well, it dovetails nicely with our wellness conversation, at least.
This is a tough one. Today's real topic, shopping for better health and wellness. All right, let's jump right into it, guys. Rajiv, I'll start with you. What does wellness mean to Americans today? I feel like if you ask 100 people, it's 101 different answers. But what does it mean to you?
That's probably right, because wellness obviously isn't a new term or anything, but it is a new trend, and at least the way people think about it is new. Because what I think of wellness and the research I did for my report, I was trying to frame it as something that exists supplementary to traditional medical care, because wellness isn't healthcare or medical care, and it's not really even trying not to be sick or trying not to have a disease, right? It's involved into a much broader concept, I'd say, that combines physical health and mental health and emotional balance and lifestyle habits and longevity. And drilling down, that could be in the form of taking vitamins and supplements or wearing a wearable or making healthier nutrition choices. Like protein is all the rage over the last year or so, it seems. Buying over-the-counter health products, and medications, and even kind of elite luxury type items or services like travel retreats where people engage in yoga and meditation and some sort of fitness athletic training. So kind of that scope is how I think about wellness today.
So everything.
Yeah,
That's a lot.
it's funny. I saw an article a couple of weeks ago saying like wellness is anything or can be everything. I was like, well, that pretty much correctly encapsulates what wellness is.
Yeah.
Yeah, I've seen some studies that say like wellness is how you feel when you feel, how you feel about yourself, how happy you are. I'm like, okay, it's so broad, right?
It's like the word vibe. I hate that word.
Yeah.
Wellness is a vibe.
It means everything
wellness is a vibe.
and nothing at all. I like the way you phrased it though in your research. You say wellness, health and wellness means things, products and services folks choose to better improve their health, not necessarily required to treat a medical condition. It's a big space. There's a Bank of America article. I don't normally read articles from Bank of America, but they had this piece of research and they were citing, was it the Global Wellness Institute? They were saying the US wellness economy is valued at around $2 trillion, largest in the world. And they were saying with a population of 340 million people, that works out to approximately $6,000 per person in annual wellness spending. I'm sure that skews towards a certain group. Not everyone's spending $6,000 on wellness, but there's $6,000 on wellness to go around apparently. Where's this come from?
Well, I was just gonna say
Mm.
yeah, when you drill down a little bit into that big spending number, I have data in my chart from a December 2025 Civic Science survey, which shows that health and wellness is the only discretionary category where consumers who are spending money in that category anyway are plan to spend more money than less money in 2026 in that specific category. So as you can see in this chart here. So it looks at the survey looked at other discretionary spending items, looking at things like home improvements and travel and investing, and people who spend on in those areas anyway more people plan to decrease spending than increase. But health and wellness is that one resilient area of concern.
Where's this come from, Rajiv? Where's this wellness culture bubbled up from?
Well, this is kind of the best question or sorry, the question that I was most interested in for my report. And I
Mm.
think it's a result of two converging trends. It's the expansion of wellness content online, especially on social media, and declining trust in traditional healthcare institutions. And it kind of makes sense, right? When you think about influencers and creators and online communities for health advice, wellness information has become a lot more accessible and pervasive than ever before. And then, if you have someone who maybe not had the best experience or best interactions with the traditional healthcare system, you then, that person might turn to alternative sources or some other channel with people who have similar experiences with them or as them as someone who might not have had the best experience with the traditional healthcare system. But of course, that also highlights some of the risks of the wellness boom because so much of this guidance is coming from non-traditional sources, a lack of physician oversight or scientific validation. But yeah, this boom is just happening online, and whether it's social media creators and AI, whether it's you know wellness fads that people are reading about online, that's just really surged over the last few years. And
Yeah,
I
there's
think
some.
we talk about a lot. We talked about this a lot with when we talk about influencers, right? I think our last talk was about the influencers,
Mhm.
health and wellness influencers as well. I mean, they're driving so much of this, and younger generations. I wrote a story not too long ago about lifespan versus health span, and younger generations are much more aware of health span, what that means. They feel like they're more in control of their health. So
Yeah.
yeah, different.
Health span for folks who don't know.
Meaning versus the years of your life, the wellness, the health and wellness you have
Hmm.
throughout your life,
Hmm. The
rather than
healthy
just counting the
years.
number of years, right?
There's a study from Pew Research Center from a few months ago, and they're basically showing Rajiv, kind of what you were talking about. It's not just that people have a high level of trust in the information that they get from people who have medical training on the topic, or transparent about potential conflicts of interest or the information that's easy to understand. There were 82% of people said that having personal experience with the topic is really important as well for them, for folks who, in terms of
right.
people they're listening to get their health information. Is it fair to say that this is kind of bubbled up because of social media, because of that word you used earlier, access?
Yeah, for sure. I mean, the doctors, I even have a section in my report with a header. People do trust their doctors, but doctors cannot compete with online health information. And people might only have a few minutes to talk to their doctor. And it might not be the most comprehensive conversation that kind of encompasses like everything that's going on in a patient's life. And even worse than that, some people don't have good interactions with their doctors. They might have perceived biases. They might not be able to get in to see the doctor that they want. What have you. Then people, turn to other information or to other sources, people with relatable experiences and are going through similar things. And GLP-1 weight loss drugs are a good example. We've done a podcast on this before, and even though weight loss drugs are, they are a prescription medication that are prescribed to treat conditions like obesity and diabetes, I consider them a wellness product. And I think most would agree because a lot of people don't take them necessarily to treat a condition, even though that's what they're intended and
Mhm.
approved for. They take them for, overall broader health management and metabolic health, and to for portion control and appetite regulation, and to have greater energy, and really to have a greater health span, to live longer, right? To live healthier and longer. So, and the reason I'm bringing that up is because GLP-1 weight loss drugs were probably the first medication that just soared in use because of social media. People would document their weight
Mhm.
loss journeys, taking the medications, and that got a lot of people to go to their doctors and ask about them. And then, peptides is another one. I can't stop reading about peptides. I'm not sure how, aware you are of this, Marcus, but
Only when you
it's the
told me about them
latest.
last
Well,
week.
yeah, it's the latest wellness craze, and peptides and GLP-1s can kind of overlap a little bit, but there are these specific wellness peptides, which are essentially unregulated, untested products. Really, they supposedly have multiple benefits, but really they're mainly taken for like muscle recovery, like recovery from an injury, but also kind of just general optimization. And they've become so popular. Doctors don't like them, but there's communities and groups that push these, that are kind of peptide obsessed, and influencer content all over about peptides. Here are the and they're not just one big thing. It's like a broader category. So here are peptides you should take, and here's where you can get them from this online retailer. And again, most of these products are not approved by the
Mhm.
FDA. They're not even supposed to be used for humans. But and you think to myself, to yourself, why would people want to take these? It's because of social media influencers and creators touting them. I have this problem with my with my health, with my daily life. Maybe you have this problem too. Here's a product that's really helped drive improvements. You can
Mhm.
kind of see why people would be willing to dip into this pool. But uh, yeah, doctors are not happy about this peptide boom.
Yeah. A lot of folks just focusing on the um, perceived benefits, as you said, helping to speed up injury recovery after an injury, reducing inflammation. But then doctors saying, pushing back and saying, "Well, hang on, we don't really know enough about these yet. They've not been approved." And so, kind of hold your horses. I want to, before we go into the next question, I want to touch on something from the piece, Rajiv. You talk about it's kind of this double-edged sword where wellness culture can empower consumers, but also heighten pressure to meet evolving health ideals. Tell us more about this.
Yeah, I think, look, at the end, ultimately, when people are reading about health information online, if they use a technology device to track health data, in a vacuum, that's a good thing, right? People are becoming more aware of maybe or how their body is functioning, and what's going on in the world around them, and how other people um, are using different types of products and supplements and services and how it's working for them. So that in a vacuum gives people more agency, I think, and over their health and over their wellness. But
Mhm.
there's just a lot of pressure, right? There's a burden to kind of conform to wellness culture, especially if you're really actively online and on social media, and you see it, wellness is everywhere. Well, yeah, you might you might feel
Left
pressure
out.
to left out if you don't conform, right?
Mhm.
And weight loss drugs are another example. There's a stat I used in my report of people who felt pressure to lose weight just by hearing and reading about GLP-1 drugs, whether that's through TV or internet advertisements, or
Yeah.
through articles, or people around them, their experiences. But yeah, you want to be careful of having the right tools in place to improve your health without going overboard and feeling pressured to do so.
Yeah.
I mean, I don't think it's a brand new thing. I'm going to chime in as a woman here. That pressure's been there for a long time. But as
Mm.
you pointed out, it's the social media, it's the access to influencers. It's not just here's a GLP-1 ad or Weight Watchers ad. You should try this. It's thousands of touch points where people
Mhm.
are hearing it and not only can be influenced, but where they can buy.
Yeah. Yeah, as we've seen with a lot of things on social media, Beth, to your point, it's not created it, but it's definitely exacerbated it. And you can see from this chart on the screen, Rajiv, you had this in your research, two-thirds of consumers, two-thirds say wellness culture creates too much pressure, according to the New Consumer and Coefficient Capital. Beth, what's the relationship between this wellness movement and the traditional healthcare world? How much do they overlap? How separate are they?
Well, I mean, I think Rajiv already mentioned that physicians aren't necessarily thrilled with some of it because it's not regulated, they're not in control of it. So I think that it depends. So GLP-1s, the P stands for peptide. So those are kind of, part of this wellness craze, and that's where doctors are weighing in. That is where they have a lot more control. But even there, because there's telehealth prescribers, it's relatively, I don't want to say easy, but you can frictionless. Let's say you can go online and get a telehealth appointment and get a prescription, and maybe not even have to see that person, maybe get a few tests. There's so many different compounded drugs out there. When it comes to the regulated ones, of course, you're going through a regular, even if though it's telehealth doctor, there you have to, have the tests and do all the things you have to do. But still, so I would say that doctors are probably not probably they're glad that people are losing weight and taking better control of their health. But then you sort of switch over and wellness as well, tracking your health. You can share that information with your doctor. So I would say they're glad about some of it, but then when you get into the, let's say, sketchier peptide sort of things, I just wrote an article about where people are getting these peptides from.
Oh gosh.
14% get them from WhatsApp, Telegram, or some other social media.
40?
14.
Oh, that's
sorry,
still high,
but still it's high. And 10% get them from overseas suppliers.
Okay. That's
that
vague.
they gray market
So
sources. Completely.
Yeah.
Gosh.
You're watching like a TikTok video of someone promoting peptides and they have a brand deal or whatever, some sort of kickback from like a retailer that sells the peptides, and here's a discount code, head over to WhatsApp and you can get this really cheap coming in from China. And again, you might think this is crazy that people do this, but they really are.
Yeah.
There was
that
a
does
New York
feel-
Times article in January that I think my mouth was open the entire time I was reading it, because it was people saying like, oh yeah, I go to wellness parties and raves and they're injecting themselves with things that people bring.
Gosh. So it's no wonder. So
Yeah.
Rajiv, you have this research in your piece. Doctors, you say, don't want patients turning to alternative sources for wellness information. You say 9 in 10 healthcare providers said they've had to address supplement misinformation patients encountered on social media, according to Tembra survey. Is there a world where these two universes can coexist and help each other out, or do you think they're growing closer together or kind of further apart in terms of the wellness movement and traditional healthcare?
I think they're further apart. There is a world where it can come close together. I just don't think it's a realistic world because, Beth noted that doctors want the control, and it makes sense. Like they need to be informed of all of, if the doctor's going to do his or her best job, they need to be informed of everything that's going on in a patient's life. And I just don't think uh, achieving that is super realistic for lots of different reasons. So unless the doctor is going to have that information, I don't think that world you describe is achievable. But yeah, doctors broadly agree with general wellness goals. I mean, this isn't going to come as surprising, but prevention and behavior change and nutrition and exercise and stress management and better sleep. Like, of course, doctors agree with those goals, but they're skeptical of how wellness has become this kind of cottage side consumer industry, and how people's wellness related decisions come from unchecked sources of information.
Hmm.
So, if a person is taking a supplement or a treatment that hasn't been rigorously tested or isn't FDA approved, there's just no way a doctor is going to like that. But a patient doesn't want to be told by their doctor what what they don't like. So that's why I don't think that the world you described is going to become a reality. So and then the other thing that I think is important is a lot of these wellness brands and marketers say that conventional medicine is the problem, and you need to try this because the conventional healthcare system and traditional prescription drugs like haven't worked for you, so come try this. And of course, doctors
Mm-hmm.
don't like that either. Yeah.
Mm-hmm.
Yeah, but I remember there's something, didn't you wrote either a story or maybe this is in your report as well, that doctors want to know, they want their patients to tell them
Yeah.
if they're taking something or.
Yeah, of course. And they want to be able to course correct, but
But people are afraid to tell them, like they hide it from them. Yeah,
exactly. I mean, yeah,
honestly,
people hiding stuff from their doctors has been, a problem forever, but
that's
now you
true.
just have more supplements and more products that they're hiding.
You're right. Clinicians remain the most trusted source of wellness guidance, yet patients don't consult them often enough. Why is that? Is that because of what you just said? They're kind of a bit ashamed, embarrassed, nervous, anxious to admit to their doctor these things they've seen online? What's the reason there? What's going on?
Yeah, it's also it's all those things, but it's also access, and people don't see their doctors all the time. They might see them every 2 months, every 6 months, every year. So they don't always have the greatest personal connections with their doctors, and this might kind of be a scary thought, but younger people especially definitely have tighter connections with social media creators, and that's probably why a lot of these decisions are coming from
Mhm.
non-medical sources.
And you had some research that really highlighted this, that they are a significant influence over people's health decisions, correct?
Yes, there's a really good Edelman Health Trust survey that came out in March 2026. And as you can see on this chart here, for certain wellness categories, so for diet and nutrition, for vitamins and supplements, and for wellness and longevity, people base their decisions, in these specific areas more on information from social media creators and AI than their doctor. I mean, that's just incredible. So for diet and nutrition, things that something that affects your life every single day. You make diet choices and nutrition choices every day, multiple times a day. More people make those types of decisions based on social media information and AI information than their doctor. I mean,
Yeah.
that's wild.
It's shocking. Yeah, doctors have AI and influencers beat in diagnosis and short-term treatment. All the other stuff, wellness,
Yeah.
longevity, vitamin supplements, diet, it goes, the influence meter is higher for AI and social media than the doctor.
People have a medical condition, then they want to go to their doctors for those frequent check-ins. But when it comes to their kind of lifestyle habits, it's more so the other sources versus their
Yeah.
doctor.
Yeah, that's what I was going to say. Those two things that are on that chart, that those are the things you go to your doctor for, right? A diagnosis or treatment, and then kind of everything else. You have 15 minutes with your doctor, so you're going to focus on those really important health matters versus,
Mm,
what kind of supplements do you think I should be taking, or how, make even as simple as, exercising, or what's the best kind of fitness device to get.
yeah.
People tend
Yeah.
to turn to others.
It comes back, have you guys on uh, regularly throughout the year. And I feel like a lot of the conversations we have come back to access, come back to cost, come back to if I could see my doctor more, then I would. And I would save these questions for them because they're qualified. They're the person with the training. But if you can't get to them, and there's this free source that's sometimes these people are physicians, sometimes they're people going through the same thing, then people would take that option as opposed to no option, because that's the other alternative,
It's
right? Is speak to no one.
yeah, and it's so yeah, the access and the cost is definitely a big issue, and can't be understated. At the same time, like for my research, I was trying to make the connection between, well, people, the healthcare system is too expensive and costs too much. So then that drives them to wellness products and services. But the more I started researching, I found, well, a lot of these wellness products and services are pretty expensive, and it's not like insurance covers them.
Mm,
But what I found was that they're still willing to purchase them because of some sort of lack of institutional trust in the healthcare system, something that's really deeply ingrained. And like so many people that, they won't they won't get a COVID vaccine, or they won't get a vaccine for their kids, but they'll go online and buy a peptide that has no regulation and no testing done on humans. So that is really tough to explain.
yeah, the trust. Yeah, that word
And vaccines are
trust.
free, basically.
Yeah, yeah. If you don't trust the institution, you're more likely to
Right.
turn away from it. And that
Right.
doesn't mean you don't want to trust the institution. You wouldn't rather go to an institution. It's saying that the current one, for whatever reason, you don't trust it. So you turn away and seek alternatives. Let's turn to this to close out. Rajiv, you talk about how brands and retailers are redesigning offers, their products, for the wellness conscious shopper. In what ways are they doing this?
Yeah, so I think what's the top line takeaway is that wellness has become a ubiquitous marketing term. It's kind of funny, like we've talked about health a lot here, but uh, because there's not really like a strict confined definition for wellness, which we alluded to. Brands across all industries are using it to sell everything from supplements, but even like financial services. Like they're using wellness in their marketing for that. So, I kind of focused in on some food companies and beverage companies and supplement makers and retailers, and how they're using wellness as sort of like a way to reshape some of their offerings, or to kind of create like a whole business around wellness. So, there's CPG brands like Unilever and PepsiCo that essentially have made really expensive acquisitions of wellness companies, whether that's a vitamin, super gummy maker, I think is in terms of Unilever, and then for PepsiCo, they bought a prebiotic soda brand. So these are companies that are not really known for like healthy items. However, but they're meeting consumer demands, and they know that they kind of have to change some of their product lines to be more wellness focused. And then retailers as well, Walmart, Walgreens, Target, have all made their items, whether it's more protein or private label items that are more wellness focused. Target said in their earnings call, I think in May, that 70% of their shoppers, buy or search for wellness focused items at Target. So again, like places
Wow.
that you really wouldn't consider as traditional wellness companies
Yeah.
are moving into wellness just because of consumer demand.
Yeah. Rajiv's got some recommendations for brands and retailers in the research, which comes out this week, and they're excellent. So we don't have time to go through them, unfortunately, but they are really, really good. So Pro Plus subscribers, you can find the full report, the Health and Wellness Market 2026 at the link in the show notes or anymarketer.com. That's all we've got time for today's episode. Unfortunately, I could talk to these guys forever. Thank you so much, though, to Rajiv.
Thanks so much for having me, Marcus.
Yes, of course. And to Beth.
Thanks, Marcus.
Yes, yes. Thank you to Lance on the production crew, and to everyone for listening to Behind the Limousine Marketer podcast, made possible by Rokt. Susie will be here Wednesday speaking with Chief Digital Officer of Rainbow Apparel, and I'll be back on Friday discussing what you need to know about the current state of AI shopping assistance.